Hepatitis C affects 170 million people worldwide. Up to 85% of those infected with the hepatitis C virus, or HCV, will develop chronic hepatitis C, 1/4 of whom eventually progress to HCV-related cirrhosis or liver cancer. Pegylated interferon alpha, typically used in conjunction with the guanosine analog ribavirin, constitutes the current standard of therapy for hepatitis C. This combination helps clear the hepatitis C virus from about 50% of HCV genotype 1 chronically infected patients, an important advancement that nonetheless represents a substantial continuing unmet medical need. Novel antiviral strategies may help address this need. However, interferon will likely remain the backbone of HCV therapy in the foreseeable future. Interferon alpha plays an important role in triggering the immune system to respond to viral attack. When it binds to its receptor, interferon alpha induces the expression of genes that place the immune system on heightened alert and help to block viral replication. Treatment with interferon alpha has been shown to be important in preventing the emergence of resistant HCV mutants when used in combination with novel antiviral therapy. Early unmodified recombinant interferon alpha cleared rapidly from the blood and required frequent administration to maintain therapeutic blood levels. The search for longer-acting interferon formulations has led to today's pegylated interferons, in which the chemically inert substance polyethylene glycol, or PEG, is bound to interferon alpha via an intermediary link. This strategy extended the half-life of interferon without inhibiting its therapeutic effect, but still left room for improvements. To prolong the half-life and antiviral activity of interferon alpha even further, scientists have developed a novel strategy to genetically fuse interferon alpha to human serum albumin. Albumin, the most prevalent protein in the blood, has a long half-life and, as a natural transporter molecule, little biological activity. Albumin-fused interferon alpha represents a new approach to interferon therapy for hepatitis C. The patented albumin fusion process uses molecular biology techniques to fuse the gene for interferon alpha directly onto the gene for human serum albumin. The fused gene is then inserted into a larger ring of DNA or plasmid, transfected into a cellular expression system. The fused cDNA undergoes transcription and translation to yield multiple copies of polypeptide molecules of albumin interferon alpha with no foreign linking material. In vitro, albumin-fused interferon alpha functions like the native constituent protein. In microarray assays, it has been shown to upregulate the same panel of interferon-specific genes normally affected by unmodified interferon alpha. The half-life of unmodified interferon alpha is short, approximately 5 hours. The addition of a PEG molecule extends the mean elimination half-life to approximately 40 to 80 hours. The median half-life of albumin-fused interferon alpha is approximately 148 hours, or about 6 days, and it is still detectable at 28 days post-injection. Albumin-fused interferon alpha may offer improvements in 2 key areas. First, the longer half-life of albumin-fused interferon alpha minimizes drug level fluctuations, providing more consistent drug exposure. Second, patients experience the majority of side effects around the time of injection, so a less frequent injection schedule may help to abate some of the side effects of therapy and will provide a more convenient dosing schedule. The effect of less frequent injections on side effects is currently being evaluated. 2 large phase 3 trials are underway to evaluate the efficacy and safety of alb-interferon alpha-2b in combination with ribavirin versus PEG interferon alpha-2a in combination with ribavirin. The first study, known as ACHIEVE-1, is being conducted in treatment-naive patients with chronic hepatitis C genotype 1. The study will randomize 1,278 patients into 3 groups. 2 of these groups will receive 2 different doses of albuterol alpha-2b, administered once every 2 weeks, and the third group will receive a standard regimen of peginterferon alpha-2a injected once a week. All patients will receive concomitant weight-based ribavirin. Treatment will last 48 weeks with a 24-week follow-up period to document sustained virologic response, or SVR, the primary study endpoint. The second study, ACHIEVE-2-3, is being conducted in treatment-naive patients with chronic hepatitis C, genotype 2 or 3, and will randomize 918 patients into 3 treatment groups, similar to those of ACHIEVE-1. In ACHIEVE-2-3, however, the duration of therapy is only 24 weeks, with 24 weeks of follow-up. Again, the primary endpoint is SVR. Because of the continued need for immunomodulation and the emerging viral resistance issues, new antivirals will likely not preclude the use of interferon. The need for improved interferon products as the backbone of evolving combination therapy remains essential for providing better care to patients with hepatitis C.